Hi, my name is Trinh, and I chose to talk about Bulimia nervosa. Throughout this presentation, I'm going to be talking about what bulimia nervosa is and why it's an important issue. I'm also going to be discussing about the population affected, the race, ethnicity, gender, and geography affected by bulimia nervosa, the dangers and cautions, as well as the prevention and practice. And lastly, I'm going to be talking about how we can implement solutions in the future that I think would work best. Bulimia nervosa is a type of eating disorder where individuals often binge on eating huge amounts of food, often with the feeling of being out of control. They use methods to get rid of the food, such as throwing up, taking laxatives, fasting, or exercising excessively. The symptoms of someone with bulimia can be difficult to tell based on their weight. This is because binging and purging is almost done mostly in private. However, some symptoms of bulimia may include calluses or scrapes on the knuckles, swollen cheeks or jaw area, teeth that look clear instead of white, and are increasingly sensitive and decaying. Their behavior may also change, as some indications may include the individual often going to the bathroom right after eating, usually to throw up, exercising a lot, even in bad weather or when hurt or tired, and lastly, acting moody or sad, hating the way they look, or feeling hopeless. People with bulimia often have other mental health problems, including depression, anxiety, or substance abuse. It's important to discuss this issue because eating disorders are mental health problems that cause extreme and dangerous eating behaviors, which can also lead to sometimes other serious health problems and sometimes even death. These individuals are obsessed with their bodies, weight gain, and appearance, but unlike those with anorexia, their problem is most likely hidden from the public because they often have a normal weight. This issue is problematic as it can prevent your body from getting the important nutrients that it needs through vomiting or taking laxatives. It can also affect your body in many other ways. For example, stomach damage from overeating, electrolyte imbalance, or tooth decay from vomiting. Bulimia nervosa can also cause problems during pregnancy. It can raise your risk for miscarriage, premature birth, delivery by C-section, and depression after the baby is born. There are no easy or simple solutions when talking about bulimia because eating disorders in general are caused by a combination of factors. Approximately 20% of people with serious eating disorders will die as a result without treatment. 3.9% of these bulimic individuals will die. Although bulimia affects women more than men, it occurs to all races and ethnicities. 1.5% of women and 0.5% of men will develop bulimia over their lifetime. Again, bulimia affects more women than men. It affects up to about 2% of women, and it affects more girls and younger women than older women. Women develop bulimia at around age 18 or 19 on average, and teenage girls between 15 to 19 and young women in their early 20s are the most at risk. But eating disorders are happening more often in older women. 13% of American women over 50 had signs of an eating disorder in a recent study. The causes of bulimia nervosa are a combination of genetic and environmental factors. This includes specific genes, a person's biology, body image and self-esteem, social experiences, family health and history, and even sometimes other mental health illnesses. There are many prevention methods available for bulimia nervosa. For example, one of them is psychotherapy, which is counseling to help individuals change their harmful thoughts or behaviors. For example, they can talk about how stress triggers their binge. Another method is nutritional counseling, where a dietitian or counselor can help an individual eat in a healthier way other than binging or purging. Most girls and women do better with treatment and are able to eat and exercise in healthy ways again. Some may get better after the first treatment, and others may relapse and need treatment again. Another method of prevention is nutrition therapy, which is purging can cause life-threatening electrolyte imbalances. Some people with bulimia may need to be hospitalized if they have serious heart or kidney problems. With the correct treatment, full recovery rates range from 50 to 70% for bulimia nervosa. However, 17% who recover may relapse after treatment. Although there is no correct way to overcome bulimia nervosa, practicing mindfulness and making a positive list of affirmations can contribute to the long-term solutions. Coping and management techniques that is tailored for an individual's unique personality and needs is also a very important aspect. For future inflammations, it is important for individuals with bulimia nervosa to be surrounded by a group of people that understand them. For example, a group therapy is good because individuals can know that they're not alone in all of this. Another example can be support groups. Girls or women and sometimes their families meet and share their stories, which is important for the individual to feel safe and included. Public health workers share the goal to prevent disease and promote health. Although we have numbers decreasing over the years, it is important to build a strong community to prevent health problems from recurring or reoccurring. In the world of social media, eating disorders have become more prevalent as individuals are starting to compare their body image to others. And it's important to raise awareness around this issue because of that. These are the references that I used in my presentation, and thank you for listening.